of patellar tendonitis and prevention. So before we delve deeper into the biomechanics on the knee and specific condition we'll be focusing on later in the video, we'd first like to show you some sport applications. In the video, did you notice how many times the player used their knees to jump? A whopping 14 times in the short 10-second volleyball clip. For sports that require constant jumping and quick rotational movements like basketball, volleyball, and track, the most common injury, believe it or not, are actually the player's knees. Specifically, the patella tendon, as it is a gliding joint moving in multiple planes during the extension of the knee when jumping and moving. The condition we'll be focusing on is patellar tendonitis, and the biomechanics of how the knee interacts with surrounding tendons and muscles. Patellar tendonitis is otherwise commonly known as jumper's knee, as this is the most prominent in those that play jump-intensive sports such as basketball and volleyball. This condition stems from the overuse of the knee and the constant stress experienced by the patellar tendon.
In order to have a better understanding of patellar tendonitis, it's important to know some essential aspects of knee anatomy. The knee is the largest and most complex joint in the body, consisting of a network of ligaments and tendons. These structures connect the thigh bone, shin bone, fibula, and patella, commonly known as the kneecap. At the top of the knee, the quadricep muscles, quadricep tendons, and femur work together to provide crucial support, stabilizing the body's weight during standing and movement. Other important components include the PCO, LCO, patellar tendon, ACO, meniscus, tibia, and fibula. Together, they enable knee extension, flexion, and overall flexibility. However, today we are going to be focusing on patellar tendon. Patellar tendonitis is a medical condition that affects the patellar tendon, a crucial component of the knee joint. This tendon connects the kneecap to the shin bone and is responsible for the movement of the lower leg, such as the bending and straightening of the knee.
These are the biomechanics concepts we will be using when applying math to the patellar tendon. First, we need to define stress and strain. Stress is the force applied to a material per unit area. Strain is the change in the material shape due to the applied force. But each stress and strain can be normal or shear. The difference between normal and shear stresses and strains have to do with the force being applied to the material. If the force acts parallel to the surface of an object, it is a shear force. If the force acts perpendicular to the surface of an object, it is a normal force. In addition to these equations, we will use Hooke's law, which is a law that states that the strain of the material is proportional to the applied stress within the maximum strain of that material. In order to understand why these tears are occurring, we need to look at Young's modulus in a general sense and in tendons. The Young's modulus graph shows the relationship between stress and strain for a material. It typically exhibits a linear relationship in the elastic region where the material returns to its original shape after the force is removed. The slope of this linear portion represents Young's modulus, a measure of the material's stiffness. By looking at the graph on the right, which is the representation of Young's modulus of a tendon, it establishes a set of conditions for these tears to occur. For example, based on the graph, we can see that the most stress a tendon can endure is around 210 newtons, and the most it could be strained is 7 millimeters. Therefore, whenever these tears are occurring, it is due to the fact that these conditions have been exceeded.
To really understand how patellar tendonitis occurs, we need to delve into the mechanics of jumping and how it affects the patellar tendon. Jumping is a complex movement that involves a series of phases, starting with the takeoff, followed by the overextension of the knee, and finally the landing. This can be seen by the video on the right. Each of these phases places a significant amount of stress on the patellar tendon, which can eventually lead to a patellar tendonitis. When we examine the knee joint with the video on the left, we see that frequent jumping causes repeated extension and contraction of the knee. This repeated extension of the patellar tendon causes small tears to form. As mentioned before, these small tears are due to the stresses imposed upon it, which comes in two forms, normal stress and shear stress. During jumping, mostly normal stress is experienced. When a person is in the takeoff phase of jumping, their leg is bent at an average angle of 70 degrees. The quadricep muscle creates an upward force while the patellar tendon produces a downward force. Both of these forces act directly on the tendon in a perpendicular manner, leading to a normal stress. Strain is also present during this phase as the tendon is being elongated due to the stress, but it would be classified as normal strain due to its orientation. While jumping, the patellar tendon mostly experiences normal stress and strain, but it can also experience shear stress and strain when there are quick changes in the directions in the knee and other similar quick actions.
Let's bring these concepts together and apply them to a real-world scenario. Using the diagram of the knee on the left, we will solve for the normal stress of the patellar tendon. We have the assumptions that we know Young's modulus, we know the initial length of the tendon, we know the change of length of the tendon, and we know the area of the tendon. We will use the normal stress equation, but to solve for the force applied, we will need to use Hooke's law and the normal strain equation. Then, we will combine the three equations to solve for force on one side. Once we convert our units to the SI units and plug them in, we will get that the maximum force on the patellar tendon is 297.87 newtons. Finally, using our original normal stress equation, we will plug in the force applied in the area, resulting in the maximum stress needed for the patellar tendonitis to occur is 744.675 newtons per meter squared.
To wrap it up, here are some treatment and prevention methods to mitigate the stress and strain on the knee joint and patella tendon. In order to prevent patellar tendonitis, proper jumping and landing techniques like a three-step approach can be implemented in order to reduce the reaction forces on the knee, therefore reducing the risk of damage to the tendon. In addition, stretching can be done to increase the elasticity of the knee joint, as well as improve overall mobility in the knee, preventing possible strain from overuse. Finally, support straps are also used to apply pressure to the tendon, stabilizing the knee joint and preventing further stress and strain. Here are the citations that we use for our video. And needless to say, us biomedical engineers will stay calm and keep the stress out as we jump to the end of this presentation. Thank you very much.